Hi, I'm Lennox Hoyt, MD, fellowship-trained urogynecologist, board-certified pelvic floor surgeon. And we're talking today about what else is my vagina doing? Your vagina, not mine. We had this long introduction to what else is my vagina doing, and we talked about the vagina as a functional organ. It helps evacuate menses. It helps guide stool and urine out. It helps you stay continent. It does a number of really cool things. It helps keep your bladder happy and soft and so forth. What we didn't talk about and what we're going to focus on today is something else that the vagina does. The vagina helps with intimacy. So sexual intimacy involves traditionally placing your husband or partner's penis inside the vagina and having sex. And what the vagina does around sex really is not just limited to the vagina. It's actually controlled by the muscles around the vagina, the pelvic floor muscles. The pelvic floor muscles also play a major role in bladder and bowel function, emptying the bowels and so forth. But it also plays an important role in intimacy as well, because it allows the vagina to grip the penis during intercourse. And that grip is part of the process of generating the pleasure for the male and the woman during intercourse. During orgasm, in a female orgasm, the pelvic floor muscles are the muscles that contract vigorously to facilitate and potentiate the orgasm as well. So it's going to be really important that the pelvic floor muscles work well in order to facilitate intimacy, which is the other thing your vagina does. It turns out that relationships are critically dependent on intimacy. Without sexual intimacy, relationships fail. It's just that simple. And without a proper functioning pelvic floor, intimacy is really problematic. If the pelvic floor is too tight, that can cause pain with attempts at intimacy. If the pelvic floor is too loose, it can create loss of sensation that many couples complain of. And so when we back up and we take a bigger view of this and we realize that 1 in 4 women worldwide have a pelvic floor dysfunction, that includes pain with intercourse, difficult bowel evacuation, urinary incontinence, urinary urgency, frequency, prolapse, to name a few things. And so if 1 in 4 women in America, for example, have pelvic floor dysfunction, that brings us down to 25 million women with a problem with the pelvic floor, potentially 25 million women with a problem with intimacy, because we said earlier that the pelvic floor is a central driver and facilitator of sexual intimacy. And we also said that without intimacy, relationships die. Most women of those 25 million will have a male sexual partner, potentially have a male sexual partner. So we're looking potentially at a universe of about 50 million Americans that are affected by pelvic floor dysfunction. And so when we ask the question about what else is my vagina doing, and we say that one of the things it does is it helps guide and facilitate intimacy, if it ain't working, we've got a 50 million human being problem. And so it turns out that pelvic floor dysfunction is addressable, curable, by and large treatable by a wide range of therapies. In the case of sexual intimacy where sex hurts, there's pelvic pain, pain with intercourse. We can look at things like physical therapy to address the pelvic floor dysfunction. If there's any surgical emergencies that contribute to the pelvic floor dysfunction, they can also be evaluated and addressed. So it's going to be really important to be properly evaluated by an appropriate practitioner, a female pelvic floor physical therapist, a urogynecologic practitioner, who can evaluate your pelvic floor and evaluate your vagina to determine if your vagina is contributing to your pelvic floor dysfunction or the muscles around the vagina have an issue. Other ways that the vagina can misbehave is that in women in menopause, the loss of libido is one aspect of loss of interest in intercourse, but actually pain with intercourse can happen because of vaginal dryness associated with menopause. It's called the genitourinary syndrome of menopause, in which the low estrogen levels lead to a drying out of the vaginal tissue. That drying out makes the vagina very thin and scrapey. So when you have the movement associated with intercourse, it can hurt. So in addition to low libido, you have a vagina that's really not receptive, not well lubricated, not well suited or set up for intercourse. So looking at what else your vagina is doing, yeah, it drives intimacy. And intimacy drives relationships. So by and large, your vagina controls your relationship, if you think about it that way. And it turns out that if the vagina is not behaving well, you're going to have problems in your relationships. It's that simple. So if you're interested in having that problem corrected, having your intimacy restored, having your libido restored, having your sexual energy and comfort and pleasure restored, there are things we can do. Fortunately, you don't have to live like that. We can get you back to a symptom-free normal, and that's what we're here for. So I'm Lennox Hoyt, MD, urogynecologist, fellowship trained and board certified. Thank you so much for watching.